Good morning and welcome to today's live webinar where we will be featuring a detailed overview of how to submit 2021 data online for our 2022 outpatient recognition programs, Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. On behalf of the American Heart Association and American Medical Association, I want to thank you for taking the time to join today. My name is Liz Montgomery. I'm a healthcare data analyst working with the AHA and AMA on all things outpatient. And I'll be presenting today's slides with my colleagues, Beth Tapper, and additional support for questions from Allison Smith and Catherine Overton. Beth, would you be so kind as to introduce yourself and perhaps Allison and Catherine as well?
Sure. Thanks, Liz. Hello, I'm Beth Tapper, Senior Program Manager in the AMA Program Operations for Hypertension Initiatives, and I support the development of the data platform on the hypertension side for the AMA, and I work very closely with Liz, Catherine, Allison, and others on the AMA and AHA teams on the Target BP Recognition Program. Thank you for joining today. I'm going to pass it over to Allison.
Good afternoon, good morning, depending on your time zone. I'm Allison Smith. I'm the Program Director for Target BP. I'm a nurse and a public health professional and delighted to work with the American Heart Association and the American Medical Association in my joint role. We're very excited about the upcoming recognition year, and thank you for joining us to learn more about some of the exciting changes and resources that are going to be available for your organization to participate in this year's program. I'll turn it to Catherine.
Hello, good morning, good afternoon. This is Catherine Overton. I'm the Senior Programs Manager for all things outpatient at the AHA. Thank you so much for joining us today. We're really excited to continue to share these programs with you, both Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. I'm looking forward to your questions and offering support in this year's submission. Thank you.
Thank you. Let's go ahead and get started. So before we really dive in, though, let's review a few housekeeping items. All participants have been placed on mute to minimize background noise. However, we're accepting questions throughout the presentation in the chat feature on your screen. Please type questions at any time and we'll answer either in the chat or when we get a chance to pause for questions. After the webinar, we'll be emailing the slide deck and recording out. Immediately after the webinar, a survey will appear on your screen. It should only take a minute to complete, and we would really appreciate any feedback you can provide to help us improve our webinar. So if you can go ahead and fill that out, we would be grateful. Getting started, as I mentioned at the top of the presentation, we will be digging into data submission today. We'll start by giving an overview of our recognition programs, then highlight resources to help you throughout the recognition process, cover the essentials and tips for submitting data in the platform. We'll then pause to give you an opportunity to ask questions before we move into a more specific step-by-step walkthrough of submitting data in this example for Target BP. First, though, I want to take a moment to congratulate again the tremendous work of all organizations that submitted 2020 data for 2021 recognition. Let's go ahead and do a quick poll for how many years have you submitted data in any of the three programs. I'm going to go ahead and select that now and launch it. So please go ahead and start. I see some of the results coming in. We've got a bunch of organizations who've submitted for 2 to 3 years. Looks like about 20% has not yet submitted data. So welcome. This is definitely the presentation for you. All right, I'm going to give it just 5 more seconds and then I will close it out so we can move forward. All right, I'm going to close that out and I'll just show that for you real quick. So if you want to take a look, you can see the results of that poll. We really appreciate you helping us out on that. I'm going to go ahead and hide that and go back to the presentation. All right, so wonderful, wonderful. Last year was such an important year to capture data, as it continues to be now. So thank you again to the over 1,100 organizations that took the time to participate and submit data. Before we move away from discussing last year, I would be remiss not to acknowledge the ongoing pandemic and the Omicron surge. We know that there is a lot on healthcare workers' plates and that burnout is real. So our team just wants to thank you for still taking the time to focus on quality improvement and on submitting data for our recognition programs. We truly appreciate your work and your role in the community. All right, let's walk through the timeline for upcoming months. Right now, we are in the data submission period. You can edit or revise your data in our online platform anytime up until the deadline of May 27th at 11:59 p.m. Eastern Time. Following that deadline, the AHA and AMA will be reviewing and validating the data submitted to classify awardees by award level. During the fall, we'll then notify awardees with your congratulations email and a toolkit and publish your accomplishments on our program websites. The recognition doesn't end there. We'll follow those with additional highlights of awardees at the scientific sessions and in a published ad. Again, here are some of those recognition benefits I just highlighted, including the promotional toolkit. That includes an award certificate, social media messages you can use, a local press release template, and our digital award icon. Moving in to an overview of our recognition program. To be eligible for recognition in any of our 3 programs, your healthcare organization must directly diagnose and manage patients with chronic diseases, including prescribing and managing medications. If this doesn't apply to you directly, but you do support or educate providers, we have some additional spotlight opportunities and features available. For example, these organizations could include employers, pharmacies, community foundations, maybe your Department of Health, or work for a health information exchange. If you're interested in one of these spotlight opportunities, please reach out to your local AHA representative and they can provide you with some more details. There's also an update that will apply to all of our program forms this year, and it is a new question on race and ethnicity. It asks, how many of your total adult patient population, ages 18 and older, self-identify as the following race and ethnicity? The table then breaks that information down into fields following the HRSA's Uniform Data System reporting requirements for 2021 health centers. If you've previously submitted data with us and this feels somewhat familiar to you, then it's probably because it replaces the prevalence estimator on Target BP, which had similar fields, but also requested a breakdown of sex and age. By updating this to the UDS table, we are moving away from over 40 fields that need to be completed to just the 16 shown here. Part of the reasoning for that is that hopefully this reduction in fields will be easing on the burden of data submitters, so saving you time to fill out all of those fields. Again, this question will be on each form, so if you plan to apply for multiple programs, it makes sense to save the query. Now, let's go more into the specifics of each program. Beth, can you tell us a little more about Target BP?
Absolutely. Thank you, Liz, for that great overview. So now we're going to go into more of these specifics of the Target BP eligibility, award levels, and data submission criteria. So starting with the participant award eligibility, there are some modifications this year around eligibility that we wanted to share. So new this year, an organization is only eligible for the participant award if they are a first-time submitter. So unlike in previous years when this award could be received year after year. However, the participant award criteria is the same, and that's a blood pressure control rate less than 70% for 2021 data and less than 4 of 6 evidence-based activities achieved in 2021. There are three primary ways a site or an organization can be a first-time data submitter. I think you want to jump back to that slide. Thanks. So if you are a new site to Target BP, you would be a first-time submitter. Second, if you were previously registered for Target BP and never submitted data prior to this year. Or lastly, if you are a part of an existing healthcare organization, also known as a child organization, whose parent organization may have submitted overall for that organization, then you would be a first-time submitter. for the participant award. And just one point of clarification, if an organization is submitting this year after not submitting last year or in previous years, but you are already registered, then unfortunately you are not eligible to be a first-time submitter. And this is just really as how our program has been evolving over the last few years. So you can go to the next slide. So here's an overview of this year's recognition criteria and levels. And these are all in alignment with last year. There are 3 award levels in addition to the participant award. So first, the Silver Award recognizes practices who submit aggregate blood pressure data and attest to implementing at least 4 of 6 evidence-based blood pressure measurement activities and do not reach at least a 70% control rate. The Gold Award recognizes sites that submit aggregate blood pressure data and achieve at least a 70% control rate of less than 140/90 for their patients with hypertension. And then finally, the Gold Plus Award brings together really the silver and gold components for practices that submit aggregate blood pressure data and achieve at least a 70% control rate for patients with hypertension and implement at least four of six evidence-based blood pressure activities. So I'm going to walk through those activities in the next slide. You can advance, thank you. So for those of you that submitted last year, this will be a brief refresher on these evidence-based improvement activities. And we do encourage all of you to implement these and really to enhance the great work you're already doing to improve blood pressure. And just a note, all data submitting organizations must attest to at least 4 of 6 of these activities to achieve a Silver or Gold Plus award. There are no significant changes last year, so these should be familiar if you've already submitted. And just to emphasize, these are attestation questions. There's no formal documentation required. It's any combination of these 6 activities, just as long as you fill in each field. So just to quickly walk through these, under equipment and calibration and validation, one of the questions is, did you calibrate all of your blood pressure measurement devices, including both manual and automated devices per the manufacturer's recommended timelines? Second, did you check to see if your devices are validated? And you can do this by reviewing an approved list of validated devices that are found on several sources. And then the second part of that is to report the percentage that are validated, and those will be in a drop-down box, and that's new this year. We do have more detailed information on this activity in the data submission worksheet, as well as in the appendix of this PowerPoint. Under staff knowledge and skills, did you strengthen staff knowledge of accurate blood pressure measurement every 6 to 12 months? That can be done through trainings, CME activities. We have a list of examples of those for you. And then did you test your staff skills every 6 to 12 months, such as a technique quick check tool that we have through Target BP or some other similar assessment? And then finally, in system of care, did you use a protocol to consistently measure blood pressure? So for example, taking confirmatory measurements when readings were initially high. And lastly, did you post a visual blood pressure positioning reminder next to every device, such as the Target BP proper positioning poster? So those are the components of the evidence-based activities. Again, it's 4 of 6. We have much more details on these in the appendix, as well as in the data collection worksheet. And we can do a deeper dive in an office hours in future months. And then finally, let's just go to the last slide. Now to review the requirements for data submission with your 2021 aggregate data for your clinic or organization. So the first question is the total adult patient population, ages 18 and older, the total number of patients, 18 to 85, with a diagnosis of hypertension and a 2021 visit, anytime in 2021. And this is based on the MIPS 236 controlling high blood pressure measure that you may be familiar with. The next question is the total number of patients, age 18 and 8 to 85, with a diagnosis of hypertension whose blood pressure is controlled. And that's under, at 140/90. And that's based on, again, on the MIPS 236. We can certainly share these specifications for this measure in the chat. I think that would probably be helpful to many of you since we don't have time today to go into these. The next question is around the total number of patients that you've just reported on that have remote readings. So Those are readings that are taken outside of the office, such as SMBP readings taken at home. And you can answer here, yes, no, not sure. This does not go into your computation for your award status. And then the total number of providers, and providers are defined as physicians, nurse practitioners, and physician assistants diagnosing and treating hypertension. And finally, the last question is the total number of adult patients in a specific primary payer group. And those payer groups are more detailed in the data collection worksheet. And before we end this section, just a couple of minor changes. Liz did mention earlier about the prevalence estimator around those new race and ethnicity buckets. So that will hopefully take away some burden on your end. And then a minor adjustment to the validated device question. That was a fillable form, and now it's a drop-down menu. So hopefully data submitters will really find this a lot easier to complete with those drop-down options. So that is the Target BP overview sort of at a high level. And as I mentioned, we do have a lot more specific details in the appendix, as well as in the data collection worksheet. So I'm going to turn it back over to Liz to walk through the check change control, cholesterol, and type 2 diabetes program requirements.
Thank you so much, Beth. That was a great breakdown. As you mentioned, I'm going to go ahead and cover check change control first. It has 2 awards, participant and gold status. These awards are tied to the MIPS 438 measure, statin therapy for the prevention and treatment of cardiovascular disease. Organizations that submit 2021 went out. If there were any difficulties hearing me there, I'll repeat that. Organizations that submit 2021 data and commit to improving ASCVD risk assessment and implement ASCVD risk calculations into their clinical workflows and have a 70% or more of their adult at-risk patient population appropriately managed per the measure guidelines will receive a gold status. If they fall under that 30% threshold, but otherwise achieve the same things, they will achieve participant status. So that is how we award our levels for check change control cholesterol. Moving on to the check change control cholesterol requirements. Data submission for 2022 will require aggregate 2021 patient data for adults, patients 18 years and older. These fields must be completed for award eligibility: total adult patient population, total number of providers, total adult patient primary groups, total patients meeting any of 3 risk group criteria for ages 21 and older, and the total number of above patients who are actively using or who receive a prescription for statin therapy at any point during the measurement period. So the first few bullet points there are the same as for Target BP, and then those additional ones focus specifically on cholesterol for the risk group criteria and prescriptions for statin therapy. We'll also ask for information on your use of the ASCVD risk score. We'll ask you, how is it calculated and how is it documented? There are 2 changes to the program form in 2022. And the first is what we'll look at more closely on the next slide, asks about treatment plans for managing very high-risk patients. The second is that we will be adding that race and ethnicity question both Beth and I talked about earlier. Looking closer at the new question for check change control cholesterol, it reads, the 2018 AHA-ACC guideline on the management of blood cholesterol defines patients with existing clinical ASCVD as very high risk of a future event if they have a history of multiple major ASCVD events or 1 major ASCVD event in multiple high-risk conditions. We ask, does your organization operationalize a specific treatment plan, such as the use of a clinical decision support tool or workflow following the AHA-ACC guideline algorithm for managing patients considered very high risk for future ASCVD events? If you answer yes to this question in the platform, there is a multiple choice selection of what that treatment plan includes. Please note that your answer to this question does not impact your award eligibility. That means if you answer yes or no, it won't impact if you receive participant or gold level recognition, but an answer is required either way. There are also 2 levels of awards for Target type 2 diabetes. Participant status recognizes practices that submit data and commit to improving strategies for addressing cardiovascular disease risk in patients with type 2 diabetes. Gold status recognizes practices that fulfill the same requirements and have an annual rate of over 25% for HbA1c poor control under 9%, and have an annual rate of 70% or more for appropriate statin therapy, or have an annual rate of 70% or more for blood pressure control. Then now let's look a little closer at the target type 2 diabetes requirements. The first three fields for aggregate patient data for adult patients ages 18 years and older are the same as for check change control cholesterol. Additionally, we'll ask for the total number of patients with a diabetes diagnosis and an office visit in 2021. We'll also ask for the total number of patients diagnosed with diabetes whose most recent HbA1c level performed in 2021 is less than 9%. We'll ask for information on your protocols for type 2 diabetes patients as well. Does your practice have a specific protocol to assess key characteristics of patients with type 2 diabetes? If yes, what characteristics? And does your practice initiate a specific treatment plan for patients with type 2 diabetes? If yes, how? The only new addition for 2022 for target type 2 diabetes is our race and ethnicity questions we've mentioned before. One thing to highlight about our target type 2 diabetes requirements is that in addition to the NQF59 diabetes measure, you can choose to submit data for either the MIPS 438 statin therapy measure or the MIPS 438 controlling high blood pressure measure. These correspond with the data from the previous two programs. I'll highlight that they do have different age ranges, so prepare to look for that when you're pulling your query. To help you prepare for data submission, we've pulled together a suite of resources to help out in addition to this webinar. Our data collection worksheets that Beth mentioned earlier break down each question in detail, especially for the payer group question, which has a full page of detailed requirements and are available for all three programs online now. You can find them on the program websites and in the library of our online platform. We've also compiled a quick user guide, which is a PDF that breaks down the steps of the data submission process we'll be sharing soon. It's also available on our websites and in the platform library now. Data submission video tutorials of a step-by-step nature for each program will be available very soon. Before we get started on data submission tips, let's go ahead and do another poll on which programs you intend to submit data for this year. I'll go ahead and launch that now and give you a moment to answer. Are you planning to submit for target BP and check change control cholesterol and target type 2 diabetes? We're hoping that we're seeing for multiple programs, I'm seeing almost 100%. We're at 95% for target BP, and about half of our current participants are planning on participating in the other two programs as well. It looks like it is slowing down, so I'll give it just 2 more seconds and then I'll close it out. All right, I'm going to close that and share those results. You can see you are in great company if you are planning to submit for more than one program. We hope this is not necessarily your final answer. If you are already, right now you're just planning on submitting for target BP, hopefully this will show you how easy it is to submit for more than one program as we continue. All right, go ahead and close that and go back to our presentation. All right. Sure. Beth, can you tell me if you're seeing my screen right now?
Yes, we are.
Yes, we are.
Okay, perfect. Thanks. I couldn't tell for sure. I appreciate it. All right, moving forward, let us cover some essential tips to getting started. There are 2 steps to submitting data for recognition. The first step is to register. This enables us to create a profile and a user login for you in the online data platform. If you're new to submitting data for Target BP, please go to heart.org/register-myoutpatient.org to register your organization. If you've submitted before and already have a profile, you do not need to re-register. You can skip straight to entering data, which we'll cover next. Just note that one registration equals to one potential award. If you want your health system and each of its individual locations to all be listed individually and each receive recognition, you'll need to submit registration forms for each. If you want to register 5 or more sites, there is a multi-site petition process in that same registration link that will save you some time. Also note that you can use the form to register for all 3 programs in one go. So no need to complete the form multiple times unless you decide to register for additional programs later on. Once you receive your user credentials by email, you'll head to our online data platform. You'll navigate to program forms, hit add new, enter 2021 because you're entering data from calendar year 2021, fill in all the fields and hit save and exit. That's a quick summary. We're going to go into more depth, but just a quick summary of the quick steps to submit data. The deadline to enter and finalize all your data is Friday, May 27th at 11:59 p.m. Eastern. The minute after that, a snapshot of all data in the platform is taken to determine every organization's award level. We also now have a speedier way for organizations to submit data for multiple individual sites in one swoop through our self-service upload tool. This allows you to type your data into a spreadsheet and upload versus typing it all into the platform. If you're interested in submitting through this tool, please reach out to us at bit.ly/AQ contact us for more information and we can help you out. This is just a quick preview of what that upload function looks like in the platform itself. You'll populate a template CSV file and drag and drop it into the platform. After the data submission window closes, an AHA staff member might reach out to you to verify details of your data. Please keep an eye out for this and respond as soon as you're able to because your response might be needed to receive an award. There are a few reasons this could happen. One is that the fields are left blank or that your measured performance rate was really high or really low, or perhaps the numbers given in target BP or check change control cholesterol don't match the numbers for target type 2 diabetes. The main thing is that we don't want a technical glitch or forgotten field to block you from being recognized. Some quick reminders: enter your 2021 data by Friday, May 27th, but the earlier the better. If you're new, register early because it can take a few days to set up your profile. When you're entering your data, use our resources for the full instructions, complete all fields and all tabs, meaning no blanks, enter 0 to represent no patients, and then check the data entry complete checkbox when you're finished. Make sure all of your data is saved before midnight on May 27th. Now I'm going to pause for some questions. Allison, Catherine, can you share if any have come up in the chat? I'll see if I can
I'm not able to see any in the chat at this moment, but you may have a different view, Liz. And I'll give you a second to scan that. We're just really excited that we've got so many on the call today. So many are intending to submit data to a variety of programs. As we all know, we've lost some ground in our control rates during the pandemic, which is not surprising. So now more than ever, we really view this as an opportunity to refocus on our chronic disease management activities, particularly for all of the patient populations who are suffering sort of disproportionate effects of the pandemic. And so thank you all for your continued commitment, your new commitment, your renewed commitment to participating in the outpatient programs. Liz, are you able to see any of the questions that our participants might have, or are we ready to move forward?
I see one question in the Q&A, but none in the chat. And I'm only seeing a little bit at a time, so I'm going to just try and paraphrase. But if you are asking about the data collection worksheets and if you can collect that data to submit at a later time or a later date, you can use the data collection worksheet and prepare. You can go in and save your form at any point. So however long it takes you to collect, enter, save that data is fine as long as it's before the May 27th deadline. I hope that answers your question. And you will, I see another question here about going on to the, if you need to go on to the website to get the slides for this presentation, we will be emailing them out as well. but they will be posted for everyone online. So if you know someone who missed the webinar, this will all be available afterwards. I think that's all of the questions.
Liz, can I add one comment about the, preparing submission on saving and exiting?
Oh, please do.
Yeah, so the way the system works, yes, there is a data submission complete check mark that you can check to ensure that you're done. However, what happens is at the very end of the recognition period, at midnight, we take a snapshot. So as many times as you need to edit or modify or add new or start and stop before that time period, that is fine. We don't take the final results until the very end of the period. So even if you say data submission complete and you need to go back and change things later, that's totally great. And you can absolutely use the data collection worksheets to prepare for that activity, but did want to just make it very clear that even if you check that data submission complete checkbox, you have the opportunity to uncheck it and recheck it as many times as you need before the data submission deadline.
Thank you so much. I think I'm seeing most of them here. I'm going to take another opportunity to look through these questions. I'm having a little bit of a hard time viewing them on my screen, so I'll go into a little bit more depth. We've got another section for questions, so if we missed anything from you, we'll be sure to answer it later or follow up with our post-webinar email to answer your questions. So let us move forward and cover our data submission platform. Of difficulty. So I think everything is restored again now. So the first step after registering is going to be logging in at the aha.infosarregistry.com/login website. If it's been a while since you've logged in and you've forgotten your password, you can use the forgot password link or the need help options. For accounts that have been deactivated over time due to too much time passing between logins, you can also contact your local AHA representative or use our Contact Us form for help. If it's your first time in the platform, or if you're updating from a temporary password, you'll be prompted to create a permanent password. Then, the first time you enter the platform, you will see our full data use and license agreement for the ambulatory quality registry. Read through and click Agree, which will be at the bottom. Now that you're logged in, don't forget to set up challenge questions for your password. These will enable you to reset your password in the future without contacting the help desk. It'll save you a little bit of time. If you have access to multiple organizations, for example, if you're submitting for multiple clinics within a single system, you'll first be prompted to select a view. Choose the organization or facility in the platform you are currently planning to submit data for. This will bring you to your community page. If you do need to navigate back to another facility, you can do that by clicking the teal Switch Current View button on the left. The top right of the community page has a series of navigation tips to help you out. You'll submit data using program forms. You can navigate there by clicking the link on the left navigation bar or the icon under Get Started. You can add site characteristics in form management to benchmark your organization against similar organizations. And you can view reports by clicking Operational Reports under Analytics. To access helpful submission resources and measure guidelines, you can visit our library. The platform library includes our data collection worksheets, quick user guides, frequently asked questions, and again, those measure specifications. If you've got a question about one of the fields required for data submission, the library will probably have a good answer for you. All right, let's go ahead and walk through the submission process now. Remember that we submit our data through those program forms. In our first view under program forms, you'll be able to see any forms that have previously been opened under edit forms. To begin a new form, you'll click Add New next to the desired program. This demo is on Target BP, so I would click Add New next to that program. Note that you'll only be able to add forms for the programs for which your organization is registered. So if you're not seeing check change control cholesterol or target type 2 diabetes at the top, you'll need to register for those programs, and then you'll see them within the data platform. Next, you'll be asked for the reporting year. Since we're submitting 2021 data, we will type 2021 into the reporting year field and click Submit. You will need to answer all questions to be eligible for recognition. This includes questions on 2 different tabs, which you can find on the right. We recommend that you save frequently as you go. The first 2 questions for Target BP both require a yes for award eligibility. The first asks if your organization diagnoses and manages hypertension, up to and including prescribing and managing medications. The second asks for you to confirm that you're a designated representative and are attesting that the questions are accurate to the best of your knowledge. Question 3 asks for your total adult patient population. Be prepared to further break down this number by race and ethnicity, as well as by payer group. On each program form, there will be a question for that breakdown by race and ethnicity, which is question 8 for Target BP, and for payer group, which is question 9 for Target BP. These questions will auto-populate into the gray boxes, which can't be edited. Each must equal the total given above in question 3. If it does not, it will cause an error. Additional questions on the facility information tab will ask you for your numerator and denominator data. If you've used digital blood pressure transmissions in your data, and for your number of providers. Remember to save your work, then move to the next tab, which is BP measurement activities. The second tab asks the evidence-based activities attestation questions that Beth highlighted earlier in the presentation. We recommend using the data collection worksheet along with our resources and examples document that you find on targetbp.org or in the program library to help you prepare to answer these questions. Remember that you have to answer all of the questions to receive any award for Target BP, not just Silver or Gold Plus. But not sure is an option for each of the attestation questions. So if you really can't determine the answer, you can click not sure and still be eligible for an award. Finally, when you've completed all of your questions, click on the data entry complete checkbox that Catherine mentioned, and you can find that on the facility information tab. Please note that if this checkbox can't be populated, it means your data is incomplete and you might not be eligible for recognition. If you can't click on it, or even before you try to, please review both tabs to ensure that no fields are left unanswered before you exit. Then when you are for sure done, click Save and Exit. Submitting data for check change control cholesterol and target type 2 diabetes follows a very similar process. You'll click Add New next to the desired program and then follow the same steps to open the program form. All 3 program forms have 2 tabs of data to enter. So it's the same for these programs as well as Target BP when you're looking for the tabs on the right. Like in Target BP, you will need to answer yes to the first 2 questions to be eligible for recognition. For cholesterol, we're asking if your organization is committed to continuously improving use and data capture of ASCVD risk estimations in your workflows and in your EHR systems. For diabetes, we ask if your organization is committed to continuously improving strategies for addressing cardiovascular disease risk in patients with type 2 diabetes. For full details on both programs, we encourage you to refer back to those data collection worksheets for each program. Again, those can be found in our library or on the program websites. So we do have a couple of other helpful features like benchmarking functionality for you in the data platform that I mentioned back at the beginning of the demo. To set this up, you'll need to fill out the site characteristics by clicking on Form Management on your left-hand toolbar, and then you can click through the following prompts, including selecting your clinical and geographic setting. Then go ahead and navigate to Operational Reports, where you'll be able to access helpful reports that show a variety of helpful statistics, including your year-over-year data and how your healthcare organization compares to all healthcare organizations who enter data or specific benchmarks from what you selected in your site characteristics. Then navigate to the operational report, and you can see an example report for Target BP from a previous year here. All right, I'm going to move forward and see, did we have any questions on data submission? If anybody can help me out with that, but I know I just ran through it pretty quickly, and we will have additional resources that cover it as well if you have questions after the webinar. But
well, I'll chime in, Liz, while you might take a moment to scan if there's anything in the Q&A, but I'll just add, sort of tie a few pieces together to say, for organizations who are new or who are considering adding on additional programs to their data submission, you always have the option to not share your results publicly. The benchmarking tool that Liz just shared is something that is really valuable to compare yourself to other similar organizations with similar characteristics as you have. And so if you're just sort of getting into or expanding your focus into other disease areas like diabetes or cholesterol, or perhaps you started in cholesterol and are thinking about blood pressure, there's an incentive to share your data and use it as you sort of shape your institution's approach to those programs. It doesn't have to be shared publicly. We certainly encourage you to do so, but realize that some organizations don't want that data shared until they reach certain levels of performance, and that's certainly understandable. So something to consider. It really helps us understand the challenges that you're facing and ways that our educational programs, tools, and resources can better support organizations. So your participation has that added benefit to help move the needle across the country. So back to you, Liz, to see if there are any questions emerging from the Q&A that we can touch on.
Thanks, that's very helpful. I have found a way to pop this out so we can read more questions. So we do have quite a few here. I'm going to start and work my way back, but I have a question on if our primary contact for prior years is no longer with us, can we have her account reset with a new point of contact or need to re-register for a different data submission account? And the answer is that we have two different accounts within the data platform. So your organization will have its own facility account, and then you'll have a user account to access that facility. You can have multiple user accounts for each facility, and we can deactivate the previous primary contact for that facility. So we should be able to, you can just submit a form at bit.ly/AQ contact us. Don't worry, I'll put it on screen again so you can find that. But you can just submit a request to have a new account created for there and just let us know the basic demographic information, so you know your contact information, and we'll get that account set up for you. But you don't need to worry about re-registering just because the person who's submitting data is changes from year to year. I also see for the Target BP program, does the training on how to measure BP correctly have to be provided by the AHA, or can it be an internal training provided by the trained staff? Allison, would you like to answer that?
Sure, that's a great question. You are welcome to use a variety of sources for both improving and strengthening the knowledge of your staff, as well as assessing the skills of your staff. So there's sort of a two-part option there. We do, through Target BP, provide free tools and resources to do that, including the Measure Accurately webinar, which also includes free CME and CE enduring credit with it. So that sometimes is an incentive. But in the FAQs, we've outlined sort of some guidance on what an equivalent program would contain, and that is rooted in the science, specifically the AHA scientific statement on the measurement of blood pressure in humans that outlines what that curricula would include, as well as the key points of assessing technique. They're outlined in that document as well. So I'll encourage you to consult the FAQs to see if the program, the internal program or external program, other options that you're considering are aligned with that. And there are many great programs out there. We just we want to make sure that you have free options through Target BP and many other choices should your organization choose to use your internal resources. Thanks,
Thanks,
Liz.
Listen. Moving along, we've got a lot of questions here. So another question is there any information online about how a non-clinical entity such as a Department of Human Services can be recognized, or is the main way to get information about this from your local AHA representative? I might ask Catherine to chime in here, but my initial response to this is that because non-clinical entities can't submit data for these programs, their interaction with the programs is varied. And so it's going to change from region to region or organization to organization on how we might highlight your participation and support of these chronic risk factor control in the community in different ways. So that might look like highlighting your achievements within a newsletter, or it might be a regional webinar that someone is putting on. So your local AHA rep would have the most comprehensive knowledge about that. But Catherine, is there anything you'd like to add on that maybe, or
yeah, I think you said it great. You know, the program that we have outlined today does require, you know, a clinical audience and the ability to prescribe and care for patients over time in a clinical setting to be awarded a, you know, silver, gold plus award. But we do acknowledge that there's a vast array of organizations that are influential and supportive of hypertension, cholesterol management, and diabetes management in the communities. And we do love to partner and work with organizations to you know, spotlight what organizations are doing and how these organizations are influencing care in their communities. So as Liz mentioned, yeah, reach out to your local AHA person. If you don't know who that is, you can use the AQ Contact Us and we can connect you. But I think there's opportunities to partner that may be and collaborate that may be you know, external to our recognition programs.
Thanks. Another question here is, if we've submitted for one program in the past and now possibly will be submitting for an additional program, would we be considered a first-time participant for that new one, along with whatever our past recognition was? I'm going to give you kind of a two-part answer here. The first part is that the first-time participant of status affecting your award level will only be relevant for Target BP. And then kind of the second part of that is that you would be considered a first-time participant for whichever new program you're registering for that you have not submitted data for previously. So if you had submitted data for check change control cholesterol last year, but no other programs, and then this year you decided to submit for Target BP as a new program, that would be considered a first year because it's your a first time, because it's your first time participating in that specific program. I think that hopefully that answered your question. Let's see, another one here. So I see a couple of questions around the total adult patient population number. And so I'm going to see if I can go ahead and pull up a slide on that specifically. So on kind of the language for that. Let me see 1 second here.
You know, while you do that, Liz, I'll just mention, take this opportunity for a little infomercial. On Wednesday, February 23rd, we are hosting the next Target BP webinar about partnering with patients using lifestyle modification and motivational interviewing. Step 3 in the hypertension control. So we have nationally renowned speakers talking about the science behind it, as well as some techniques. So we hope that you can join us, and that registration is available on Target BP now. So thanks, Liz, for getting your slides up. Back to you.
Yeah, no problem. I was trying to see here. So we are asking across all 3 programs, what is your total number of patients ages 18 years of age and older in the healthcare organization, regardless of diagnosis? For additional information on each of these, I would refer you back to the data collection worksheet. trying to think on hand if there's additional guidance I can give here. Catherine, do you have any input on this question beyond so it's just one of the questions reads, is this the number of adults who visited the healthcare organization at least once in the past year? And then we had another question asking if we define this number based on, wait, hold on one second. I thought I was reading the right question. It was if this aligned with the UDS guideline of it being, I think it said like on June, a specific date of the year.
Okay, so I think I understand what the second question is asking. So this question, the total number of patients 18 to 85 years of age, it does not actually relate to the hypertension measure itself, as that measure looks at just patients with hypertension. This is really a measure that is, or a figure that is looking at understanding the scale of your organization. So we are looking at, again, patients that have entered the institution, have an encounter at least once is a really great way of looking at it. You are going to need to understand the payer data and demographic data for those. Another question that we often get for this kind of adult population question is, what if I have like a dental clinic? Do I include those patients? No. We're only looking for the patient, kind of the adult patient population that could be potentially eligible for a hypertension encounter, maybe screened. They're really the clinical encounters that are happening in the clinical side of your house. Hopefully that helps. So to some, it's clinical patients that are happening in the inpatient, or not inpatient, but in the clinical setting. And then that are 18 years of age, there's no diagnosis associated, but you do need to know their payer and demographic data. And really the intent of this question is to understand the scope of your institution. For example, if you have 100,000 patients, but 500 hypertension patients, like, we might be, looking at hypertension incorrectly here and need to dive in deeper. Hopefully that answers the question.
Yeah, thank you so much.
Sorry, this is Beth. I just wanted to add, so that question does not have an upper age limit. And you'll notice that the denominator for the hypertension measure does have an upper age limit of 85. So just something to note.
Yeah, and that's specifically for Target BP, just to note that the number of patients ages 18 years and older, that question, number 3, will apply across all 3 programs, but the age groups for the denominator and numerator change from program to program. Just something to keep an eye on as you complete the forms. Okay. So thank you. These are fantastic questions. I know we're getting closer to time, so I think we have time for just a couple more questions before wrapping up. I see, where did it go? So I have a question on, for the total number of providers for aggregate 2021 data, if I'm registering a nephrology practice within a large health system, are we only counting providers and patients within that practice? And I would share that we are looking for patients who, providers or nurse practitioners, whoever is helping to diagnose and manage patients with that condition. So for Target BP, if they are helping with the patients who are diagnosed or being managed for hypertension, we would want them included within that count. Is there more details you'd like to share for that, Catherine? I'm trying to jump back and forth between slides here.
Yeah, no, I think it seems like the question was maybe around scale of the count for the clinic versus maybe the larger system. I think the count of the providers should align with the total population count that you are submitting for recognition. So if you're just submitting your nephrology clinic, the count for the providers would align for just the nephrology clinic, not necessarily the broader system and a patient population that you are not asking to be recognized for or accounting for in your practice.
Great, thank you. I think that I have gotten most of the questions in here. I see one more asking if they can apply for both a participant status and a silver status the same year or just one. And for each program, you can achieve one award. So the award is based on the results of the program form, but say you're a first-time data submitter, you might achieve, if your control rate for Target BP is below 70%, you might achieve either a silver or participant award. But if it's over 70%, you might achieve a gold or gold plus award. The silver or gold plus, those are what is using the evidence-based attestation questions. And if you achieve 4 of those 6 activities, that's what brings you up from a participant to a silver or from a gold to a gold plus. So I hope that is helpful.
Yeah, and I would just add there, Liz, that you don't have to apply for a specific award. We take the data that the complete, data set that you provide for us, and then determine award status based upon that. So you don't have to choose which one you're applying for, if that was part of the concern as well.
Yeah, thank you so much. Okay, I think I've covered all the questions here. If not, in just a moment, I am going to go ahead and share our contact information again. But just before we wrap up, to make sure we have enough time, I want to share a few takeaways. So please remember to enter and save your final data by the deadline of May 27th. We encourage you to enter that as early as you're able to. That way, if any questions come up, we're able to help you out. And just, knowing that it is off your plate, it would be great. So please go ahead, enter early. You can register for any and all of our programs online at heart.org/registermyoutpatient.org. And on screen now are our links that we've mentioned throughout the webinar for each of our program websites. We are here throughout the process to help you out. Questions on resources, submission, benchmark setup, improvement support, the AHA and AMA staff would be delighted to assist. I'm going to go ahead and share that contact information. Here is our form for all general questions. If your question was not answered today, please feel free to reach out using the bit.ly/AQ contact us. And then if you have any issues with accessing your account, you can also use the InfoSario outcome support at quintiles.com. And I would like to thank everyone for joining us today, and also to thank my co-presenters, Beth, Allison, Catherine. Thank you so much for helping me to answer questions and supporting all of our data submitters for 2022 recognition this year. We will have office hours in March and May, and we will share those registration links with you in an email following the event. So thank you all so much.
Thank you. Have a great day.
Thank you. Thank you.
Thanks for joining us.
Thanks for joining, everyone.
Thank you.